Yeah, I see that now. Great. Yay. Wait. Alrighty. So, hi, my name is Michelle Aragon.
I am Frank Valdez Suarez.
Hi, my name is Anna Perez.
Hello, my name is Jennifer Stim.
Okay, and today we're going to talk about the pros and cons on physician-assisted suicide. So, physician-assisted suicide is a very controversial moral problem that calls into question the balance between patient autonomy, medical ethics, and the role of doctors in end-of-life care.
Healthcare provider assisted suicide allows patients to have autonomy in their death when they have medical conditions that can no longer be cured. As patients have illnesses that do not allow them to live normal lives anymore, assisted suicide may be the only option to end their suffering.
Ethical principles that support the idea of healthcare provided assisted suicide as a means of ensuring death with dignity. The ethical principle of autonomy supports healthcare provider assisted suicide by respecting a patient's right to make informed decisions about their own life, including the choice to end it to avoid undue suffering, giving them the right to die in their own terms. Autonomy supports a patient's right to choose assisted suicide, emphasizing self determination.
Great point. But assisted suicide goes against the most important moral rules of medicine, especially those duty to protect life and not hurt or harm anyone. It goes against the sacredness of life by letting people kill themselves, which can make people less trusting of healthcare workers like us. Concerns are also raised about possible abuse, pressure, and the slippery slope that leads to more widespread euthanization.
However, the NAA code emphasizes respect for human dignity and the right to self determination, stating that nurses should respect patients' decisions provided they are informed and voluntary. Again, also, beneficence, which is the duty to do good, may also be invoked to alleviate suffering when no other options provide relief. Beneficence involves acting in the patient's best interest, which may include relief suffering, allowing a terminally ill patient to actively choose to end their life.
Do no harm, or the concept of non maleficence, is one of the most important moral duties in medicine. It is a direct conflict with the physician assisted suicide. Supporters of physician assisted suicide or healthcare assisted suicide say that it eases suffering, as you stated, but while us opposers say that it will hurt the patients or the people because they're individuals in the long run by ending their lives instead of helping them find other ways to deal with their pain and grief. Legalizing this could cause a lot of hurt, a lot of mistrust in healthcare, making patients already struggling with disabilities, mental illnesses, or limited access to good care feel like they're less useless or more useless. Sorry. Next.
All right, mine, right?
Mhm.
Patients and their healthcare proxy currently have the option of hospice and comfort measures only. In this case, the patient or healthcare proxy have the option of morphine drips given as the patient passes away without any pain. This option is only different from assisted suicide. In the case that assisted suicide would happen right now versus comfort measures only may take hours or days.
True, but medicine is not always exact, and cases of misdiagnosis or unexpected recovery are not unheard of. Patients may be told they have only months to live, yet some go on to live for years or even recover. If assisted suicide is an option, some individuals may choose it at all times, robbing themselves of potential time they could have had with their loved ones.
Patients with terminal illnesses will not get better. Patients lose their functional ability, for example, with control of urinary output or bowel movements. The patient is the one going through that and now exposes them to feel even more like a burden. Ultimately, guidelines would be in place for patients with illnesses that have no prospect of improvement.
I agree, but terminal illness is often accompanied by depression, anxiety, or feeling of hopelessness. A, a patient requesting assisted suicide may not be making fully rational decision, but instead acting under emotional distress. Instead of approving assisted suicide, healthcare professionals should ensure that the patient receives comprehensive mental health care and emotional support. Also, in a religious manner, many religious traditions, include Christianity, Islam, and Judaism, consider life sacred and believe that only a higher power has the right to determine when a person should die. In this perspective, taking one's own life or assisting in doing so is seen as morally wrong. From this standpoint, suffering may be seen as a test of faith. A healthcare provider should support patients in their struggle rather than help them die. Now, our conclusion.
In conclusion, we support physician assisted suicide as a compassionate and ethical option for individuals facing unbearable suffering from terminal illnesses. Upholding patient autonomy, we recognize the right of individuals to make informed decisions about their own end of life care. Beneficence guides us to alleviate suffering, and in cases where palliative care is insufficient, assisted suicide provides a dignified alternative. The ANA and ICN codes of ethics emphasize respect for human dignity and patient centered care, reinforcing our stance that healthcare providers should support choices that prioritize quality of life. By legalizing and regulating physician assisted suicide, we ensure that patients can exercise their autonomy within a framework that safeguards ethical medical practice while honoring the fundamental values of nursing, which is compassion, respect, and advocacy.
Okay, that's it.
Yay. We did it.